Welcome to the next edition of the Beyond the Blade podcast. I'm Dr. Zurarian, and today the topic of conversation is going to be centered around pre and post surgery treatments that you should consider to optimize yourself before and after a surgery. Why am I bothering to bring this topic to light is mainly because I want you as our audience, other plastic surgeons, patients, that already have had surgery, maybe thinking of having another procedure, or patients that are just meeting us for the first time, to understand the value and the importance of optimization before and after. So let's dive into the world of pre-surgical optimization. It's a topic that I really enjoy. I really like to focus and emphasize the importance of preparing yourself. I tell people that if you were going to go run the Boston Marathon, you are not going to just do some neighborhood walks 2 or 3 times a week to get ready for that. You are going to start to train. You may even find yourself a coach, and you're going to put in some serious mileage before you decide to get to Boston and do that marathon. So surgery should be approached in the same manner. You should be thinking about how you're going to prepare your body, your mind, for the experience of a surgical procedure. That starts way before your operation. So my favorite patients and my favorite cases are those who plan their surgery at least 3 to 6 months ahead of time. I know that those patients are serious about their surgery. They have done their research. They have looked at before and after photos. They've read testimonials and reviews. They've listened to my podcast. They've come in for a consultation in person, and they're attentive, and they're excited and positive about the whole process. So, in order to get ready for surgery, you want to consider what are your wellness and lifestyle characteristics. We at Hydrology Wellness, which is our sister company here in Coral Gables, Florida, is dedicated to your pre-surgical optimization and post-surgical care. So, what we do is we basically have a conversation about what are the different modalities that we can offer you to help get you ready. So one of those is a discussion about IV fluids, about hydration before surgery. Hydration is critical when it comes to having a good outcome during the procedure and afterwards, because dehydration is actually one of the triggers for blood clots, for developing a very lethal and very, very difficult complication to manage, although albeit very rare, less than 2% chance on average. But dehydration can really trigger a blood clotting event during surgery and immediately afterwards. Most of us are not very good at drinking water and drinking enough of it. I know personally a lot of people that they just don't like drinking water. They don't like drinking plain water. They have to flavor it, they have to put gas in it, they have to do all kinds of things just to drink enough of it. And that's a big problem. So, right before your surgery, 24 hours before, coming by hydrology, getting your optimization IV accomplished, which is basically a liter of IV fluids. We put some vitamin C to just prepare your body for the trauma of the procedure, of the operation. That is going to pay dividends the next day when you show up in the morning and you're there at 5, 6 in the morning getting ready to start the procedure. You already are ahead of the game. The anesthesia providers, they love it. As soon as they give you the anesthesia, they can see on the monitors that your blood pressure and your heart rate, they're all stable, and they don't have to play catch up and start filling the tank, which is basically giving you more and more IV fluids to keep your blood pressure stabilized during the surgery, because you already did that legwork before you showed up. Okay, so you're prepared, and preparation is critical in all aspects of life, and that includes in surgery. So at Hydrology, we can get you your pre-op IV. The other thing that really affects, in my opinion, affects the outcomes of surgery is your mental state. Okay, where are you psychologically the morning of surgery? Okay, it's normal to have anxiety. It's normal to have your fears. It's normal to be a little bit restless. It's very normal not even to sleep at all the night before, because you're just so excited, and so you have all of these emotions going through your body and your brain and your mind. So it's important to relax. It's important to take a deep breath. And I know from experience, a lot of people are very busy. They, up to the time of the surgery, they're working, they have kids, they're multitasking, they're a wife, they're a mother, they're a daughter, they're just, doing all kinds of things, and they're not taking care of their mental health. Many women come to the morning of surgery, and those that haven't prepared, it is obvious when they enter the clinic due to their levels of anxiety. Okay. Anxiety needs to be combated with education and with knowledge. So the more you listen to my podcasts, the more you educate yourself on the surgeries and everything that we have to offer you, the less anxious you're going to become, because you're going to begin to understand that you are in very good hands, that you are dealing with a team, not just the surgeon by himself, but with a team that really cares about you and that really has your best interest in mind, and that are all very well educated and that work very cohesively as a team. So mental health is critical. And what we can do for you at Hydrology the day before you have your surgery, or in the weeks before if you live in Miami or South Florida, is to start a massage therapy program. Okay? Massage therapy has been found clinically to give you a deep degree of relaxation. It helps to calm your mind. It helps to relieve a lot of the tension that you build up over time in the neck musculature and the trapezius and the shoulders, all of that body tension that a lot of us, we just have, and it's very difficult to release just through physical exercise. Massage therapy has been found to provide a lot of these wonderful benefits for your mental health. So I would encourage you to start on a massage protocol even before you have surgery. A lot of my patients focus only on the aftercare. What is the aftercare? What are we going to do after? Yes, massages are super important after surgery, and they're vital. And in my book, they're mandatory for many of the surgeries that I perform, with a licensed massage therapist that has added qualifications in lymphatic massage therapy, which is what we have in our facility here at Hydrology. And you want to go to the right person. Why? Because you want to have that person being supervised by a medical director. And a medical director is not a radiologist, a pediatrician, okay? It's not an endocrinologist. It's a board certified surgeon, okay? You need to go to facilities that have reputable medical directors. And I think a lot of people fail to consider this or do their research. They'll go to a med spa and the med spa will say, we have a medical director, but he ends up being a radiologist. What does a radiologist know about wellness? Okay, I think that's a rhetorical question. I think you guys know the answer to that. Not much of anything, honestly. Okay, they're too busy with being radiologists. So you want to go to somebody who can give you guided care. And so that's what Hydrology and Zuri plastic surgery are all about. So think about your mental health. Okay, think about how you're going to do some meditation on your own. I know it's hard to find the time, but if you schedule massages, okay, that could be your meditation time. That could be your self-improvement time in preparation for surgery. Some of the other modalities that we offer are red light therapy. Red light therapy has been clinically also proven to improve your mood, to decrease anxiety, to decrease depression. Why? Because you're getting these red light waves that basically they don't cause any aging. They're not UV rays, but they have all of the added benefits of basically being outdoors. And, a lot of people don't have time. A lot of people don't have time to spend an hour every day outside getting direct sunlight. So while you're at Hydrology, you can knock out multiple sessions at a time. You can jump into our red light therapy session, you can jump into your massage, and you can get your IV, and you can get all of this streamlined for you so that you can be the most effective at pre-surgical optimization. Another device that I love, which I think is also very important to talk about, is the Balancer Pro. Balancer Pro is a lymphatic compression body suit. It looks like you're going to go to outer space. It looks like you're ready to go to Mars. But what it does is that it provides sequential and rhythmic compressions of your lower extremities, of your thighs, of your calves, of all of your torso, your biceps, and this rhythmic contraction helps the lymphatic flow to be awakened. It helps to stimulate that lymphatic drainage before your surgery. If you're already coming into surgery in an inflammatory state, meaning you have an accumulation of lymphatic fluid, you're not exercising a lot, your mental health is poor, you're very anxious, or you have some other mental health concerns like depression, that's not going to help you. And then on top of that, you're dehydrated and you're not eating well before surgery. That's going to lead to a scenario that can lead to other issues down the line, which are not going to be positive. So you need to also work on considering nutrition as a very important part of the protocol. Now, in my practice at Zuri Plastic Surgery, we recommend through our preoperative instructions, we recommend specific supplements that are very important. Okay, we want to make sure that your iron levels are adequate. So we have a product that we can recommend called Floridex and Hemaplex, and then we want to make sure your vitamin C levels are appropriate and your B12. And so all of these pre-surgical diet recommendations are very important. There's also a product called Prostat, which is a high protein supplement, which is taken in a very kind of like a shot glass, quick, drink that really augments your protein levels. And that's important because, as we've talked previously on this podcast, you can refer back to a wonderful podcast that I had with Jennifer Shim, who's a nutritionist, on the show. You can refer back to the specifics on that, but protein plays a very pivotal role in providing you the building blocks that you need for scar healing, for scar maturation, and for reduction in inflammation, in swelling, and all of these aspects. So very important to consider nutrition, mental health, to consider lymphatic flow, reduction in tension and stress, and hydration. All of these are really, really important. You can always, if you come by hydrology, other ways to improve your mental health and improve your physical health have a lot to do with cold exposure therapy. Also contrast therapy, so cold plunge, and then jumping into the infrared sauna, doing some cryotherapy. All of those are going to really help out as well. Another tool that I really like to use and have patients do before surgery is called hyperbaric oxygen therapy. Hyperbaric oxygen has been found to increase tissue oxygenation, which is going to help your body fight a lot of the possible infections, bacteria that can cause infections after surgery. It also helps to enrich the tissue with oxygen so that it can heal better, heal faster afterwards. And you also do a lot better under general anesthesia because you're not going to be in what we call a hypoxic state, which means a state in which you have low oxygenation levels. On the contrary, you're going to have higher tissue oxygenation, which is going to be better for you. You're going to need less oxygen administered to you during the surgical procedure, during the general anesthetic. And that's something that we've been finding anecdotally with our anesthesia providers for patients that have done multiple sessions of hyperbaric before surgery. They're 1 hour sessions. Bring an iPad, bring your favorite book, or just take a nap. A lot of our patients love to just take a nap. They fall asleep in the hyperbaric, and it's another way of doing a lot of kind of meditation and relaxation. Okay, so those are pretty much a lot of the pre-surgical items that I would recommend for you if you're looking to have surgery and you're planning ahead, you're preparing, you're getting ready. Now, everybody needs a good coach in life, maybe a good mentor, somebody that can help guide you, and that's what we have at Hydrology. One of our providers there can really help you navigate as a health coach. She can help you navigate a lot of these really nuanced, detailed questions about nutrition and about sodium intake and extra sugar, carbohydrates, proteins. She can really break it down for you at that level. You also have access, of course, to a nutritionist through Jennifer Shim that you can consult with as well if you really want to optimize your health and wellness before surgery. Now, During the operation, we will be in total control as your surgical provider and your anesthesia team, as well as the nurses. So you are basically going to end up taking a nap during the general anesthesia portion and during your procedure. You're not going to hear anything, smell anything. You're not going to feel anything. You're going to take a nice nap, and then we're going to wake you up when we're done. And you're going to be with the one on one care of a registered nurse. And they are going to help you in the recovery area to control any discomfort, to help you feel better, continue to hydrate you, and prepare you for eventually going out of the clinic, being discharged to wherever you're going to go. That leads to the next conversation about where should you go after your surgery. If you live locally in Miami and you have a strong support network, maybe a very involved husband or wife or mother or father or some family member, that's great. You can go home with them. They are going to be your advocate. They're going to drive you to our clinic for your post-operative visits. They're going to help you with your dressings, etc. Now, if you're coming from a far away location and maybe you don't have the opportunity to bring someone with you, we can get nurses that can stay with you, and where you stay is critical. So let's jump into that topic, because in Miami, there are so many places that you should not consider to stay at. And those are called recovery homes. Okay. Recovery homes in general in South Florida are not legal. Okay. They are basically a side business, kind of like the dark web, I would call it, where some people buy a house in a random neighborhood and they start a business where they are, quote unquote, recovering plastic surgery patients. First of all, this is not legal. This is being tracked very carefully and monitored by the Florida State Legislature and local law enforcement, because these places are not being registered appropriately and are not in proper zoning locations. Okay, you cannot buy a residential property in the middle of a neighborhood and convert it into a recovery facility. That is not legal. So please be careful, okay? Because you can go online or through word of mouth or through Facebook groups like our Facebook group, for example, where people talk about recovery homes, okay? I do not recommend that. I cannot vet the sanitation levels. I cannot vet the educational and certification and licensure of not only of the facility, which again, this is not a legal facility, so it's not going to have any of that, but even of the people that are there taking care of you. Okay. And that is very scary to me. And you need to be a smart consumer on that end. So we have partnered in that regard with the Thesis Hotel. And the Thesis Hotel is basically a mile away from Zuri Plastic Surgery, which is a mile away, right across the street from South Miami Hospital. Okay. So if you're staying at the Thesis Hotel, you're a mile away from me and the hospital, because we're equidistant. The hospital is directly across the street from our building, from Zuri Plastic Surgery. And so you're going to be very close to me, my team, and the hospital for whatever reason. Okay, so you're going to be very safely situated. The other thing is that Hydrology Wellness is in the same physical location, in the same building practically, as Thesis Hotel. Thesis Hotel is amazing. It's modern. It's wonderful. Easy parking, valet, 2 restaurants on the first floor, and full access to hydrology. We even, in many cases, can go into your room, your hotel room at Thesis, and our massage therapist can provide services for you at your hotel room. Okay, this is phenomenal. All right, we're talking about giving excellent service, very one-on-one care. And so staying in the right location is critical, all right? You want to be at the Thesis Hotel and you want to have the appropriate care. Once you've gone home after surgery and you've gone to the Thesis Hotel, then the next day you're going to be coming back to see us again at Zuri, because we want to have a very close eye on you. And after that visit, then you're going to be free to start on all of the post-op therapies that I would recommend. So at that point, you're going to continue to do IV hydration at Hydrology with vitamin therapies to continue to stay hydrated, because you need to continue to do so, because what happens after surgery is that a lot of people, they don't drink a lot. Okay, they don't feel like they're hungry. They're not too thirsty. The anesthesia is kind of going through the process of metabolizing, And so they can get very dehydrated. And that's a critical moment in time as well, where you don't want to be dehydrated. So post-op IVs, obviously, the post-op lymphatic massages are going to come into play after your surgery. And this could be 24, 48, or 72 hours after. It just depends on how you're feeling and what kind of surgery you had done. And then between those two, those are the most critical components, okay, for post-op recovery. Obviously, your nutrition, which you're going to be monitoring yourself, is very important. The supplements are also going to be important. Now, if we get into a further timeline, after about 3 to 4 weeks, you're going to start to do red light therapy. Why? Because red light therapy is going to help your scar mature in a much better manner. You're going to get a better scar. You can also do other scar treatment protocols within the first couple of months, such as IPL laser with Lumecca. You can do skin pen microneedling, which we did an amazing podcast with Dr. Thomas Hitchcock, which is the CEO of the Skin Pen Crown Laboratory Company. I urge you to listen to his podcast, The Science of Skin, with Dr. Thomas Hitchcock, and to listen to our interview with him. You can do microneedling, you can do laser therapy, you can do silicone scar sheeting therapy with our Silogen product, which we have another amazing podcast on Silogen as well on this channel that you should tune into. And all of those are going to be wonderful post-op treatment items. Even something as simple as laser hair removal after a tummy tuck is phenomenal, okay? A lot of women forget that when we reorganize the anatomy of the abdomen, when we do a tummy tuck, some of the pubic hairs can grow through the scar. And those can cause a little folliculitis, a little kind of, when you shave, it can cause a little bit of issues. So really think about laser hair therapy there in that vaginal, pelvic, mons pubis area. Excellent idea to do, okay? Because you can really get rid of a lot of those issues with folliculitis and little like ingrown hairs that can happen after a tummy tuck in that area. So hydrology is your resource. Hydrology is, was developed for you by a board certified plastic surgeon for his patients, and also for anybody who's just interested in anti-aging and wellness and, in prevention of a lot of common diseases. So I wanted to give you that more in-depth idea of like how you should get yourself ready for surgery, the surgical process, and then what to expect afterwards. So if you're interested in diving deeper into any of these topics, please check out our channel on YouTube, on Spotify. We have great interviews with top scientists, CEOs of many of the companies that offer us amazing technologies nowadays in plastic surgery. And also check us out for a lot of information on wellness therapies that we can offer you here at Hydrology Wellness in Coral Gables. We look forward to another edition of the podcast and having you tune in. So for now, thank you for joining.